Namaskar. Okay, when we think of yoga for physical trauma or yoga for any kind of an ailment, one of the first things I want to mention is to avoid saying that yoga is a cure. Yoga can help with a lot of things, and sometimes yoga, I have to admit, does appear like it cures a lot of different ailments. But with all that said, we also know that you're going to run into skeptics, and depending on exactly where you live, you may have a court system where there's a lot of lawsuits that fly. And in that case, you have to be careful of your words. In one country, you might be able to say yoga is a cure. In another country, if you say yoga is a cure, you might find yourself in court. So, my point, don't make promises that you can't fulfill. Now, when we go and we think about physical trauma, we're thinking of a sudden accident, something that's just occurred all at once, and it's changed the person's lifestyle. One thing that comes to mind right away, auto accidents. Another thing that might come to mind is ski accidents, something that could happen on a ski slope, or maybe a hiking accident, a horseback riding accident, and so forth. So whenever a student or a client has come to you, they have an existing injury and they want some help as far as healing. They may have been referred to you by their physician, by their physical therapist or occupational therapist, depends on who sent you over to the client, or depends on who sent the client to you. Now, the thing you want to do is you want to completely understand the injury. So if you want to understand the injury, one way would be to have some kind of relationship with chiropractors, physical therapists, and other people in the area. Sometimes physicians do have relationships through networking with yoga teachers, and that's mutually beneficial. The other thing is you should know anatomy, and you should understand how movement affects certain things like pain with an existing injury and so forth. You should understand the practical applications of anything that you do. And in this case, when we're talking about physical pain, we're probably talking about physical adjustments, physical asanas, physical pranayama. So we're talking more about using something that's physical to fix something that's physical. Most of all, if someone seeks out your help for an injury that they already have, the number one thing you should be sure of is that there's physician's approval. So you want to make sure they have a doctor's note. The doctor has approved them coming to you in the first place. This will help you, and this will help the student, and possibly this might make it so that there's some kind of network or dialogue going on between you and the physician, or at least the physician's office. For that reason, it makes it a lot easier to work with somebody and work a specific routine around a specific physical ailment. With all that said, I want to wish you farewell. Om Shanti.